I'll be talking about delivery of Adcanumab analog by scanning focused ultrasound, improves memory function and reduces pathology in the APP23 model of Alzheimer's disease. So there's neuropathology in the brains of Alzheimer's disease patients, and there are two histopathological lesions that are intimately associated with the disease: the buildup of intraneuronal tau tangles and the extracellular accumulation of amyloid beta plaques composed of amyloid beta peptide. And this excess amyloid beta peptide buildup in the brain has been causally linked to AD by genetic studies where mutations that increase A beta production cause AD. It's believed in sporadic AD, A beta clearance is impaired. Therapeutic approaches that clear this excess A beta are being pursued and are potentially disease modifying. One such therapeutic approach is the anti-A beta antibody Adcanumab, which is submitted to the FDA for possible approval, and where efficacy might require high doses over a long time, as suggested by their phase 3 trial. So we use the APP23 mouse model of AD to investigate therapies that target amyloid beta, and these mice have memory impairment and amyloid beta plaques, which we can assess. So we, like other groups, use focused ultrasound to open the blood-brain barrier using microbubbles, and the approach we take is a scanning approach we call FUS, where we can treat the entire brain of the mouse by mechanically moving the transducer and treating for a short duration in each spot. And we've identified parameters which in our hands give safe opening over the entire brain of the mouse. And we have previously shown that the approach reduced amyloid plaque pathology on its own, and this didn't require any therapeutic agent to be injected. So we saw plaque reduction. But this leads to the question, how does our FUS approach compare to anti-amyloid immunotherapy, and what about the combination of FUS plus an anti-A beta antibody? So the timeline of the experiment was that we treated 13-month-old APP23 mice, and they were treated, given one of 4 treatments, either sham or FUS treatment, and Adcanumab or vehicle treatment. The groups were assigned based on performance in a memory test. And then we gave 4 treatments of the antibody or vehicle, or FUS or sham, and retested their memory. And then we performed maintenance treatments and aged the mice and assessed plaques at a later age. So the result was that mice that received the combination of FUS plus Adcanumab had improved memory performance. And this was apparent in the APA test, where mice must learn to avoid a shock zone in a rotating arena by using extra maze spatial cues. And so mice avoided the shock zone, so they got fewer number of shocks, fewer number of entries to the shock zone, and their time to first entry was higher when they received the combined treatment with FUS plus Adcanumab. In terms of plaques, we found that the combined FUS plus Adcanumab treatment reduced plaques in both the cortex and hippocampus, which we analyzed separately by Campbell-Switzer staining on the brains of the mice. And interestingly, mice that received Adcanumab alone had reduced plaque burden in the hippocampus, but the reduction in the cortex was not statistically significant. And the mice that received FUS plus vehicle treatment had reduction of plaque burden in the hippocampus, but this was not statistically significant in the cortex, showing that the combined treatment with Adcanumab and FUS was the most efficacious treatment. And the combined FUS plus Adcanumab treatment increased the brain levels of Adcanumab as detecting a fluorescent version of the Adcanumab antibody in brain tissue and brain lysate. And the Adcanumab, when delivered by ultrasound, was much better at decorating plaques. So we believe that FUS might have utility in the treatment of AD, increasing the brain uptake of antibodies. which might be beneficial. I'd like to acknowledge people who helped and research support.